This is the Perio Patient Podcast, a podcast produced for my patients. This means if you are someone else listening, you should not take my words as medical or dental advice for you. My name is Ben Young. I am a practicing periodontist in San Antonio, Texas. Welcome, and let's get started. What you've just heard was my introduction on the very first podcast that I made, this is podcast episode 90. So 90 podcasts ago, that was my introduction. It still works. This is a perio podcast for patients and anyone else who cares to listen. My name is Dr. Ben Young, and what I'd like to do is just talk about what's going on in our lives today, post-pandemic, and with masks more or less having come off. We're back now, or we're now, not back, we are now into a new time frame, and I'm thinking that we will recover. In a lot of what I write about has to do with recovery. It's recovery both in the world of perio for periodontal patients who need to have healthier mouths. That's why they come to me. Placement of implants for teeth that are missing. These are part of an overall recovery that somebody is going through. And I have, in my own life, been through a divorce and had other challenges that have resulted in me becoming very interested and participating in 12-step recovery groups. I think I use my mind as a practitioner in healthcare, and in studying the recovery process, I see a lot of things that are of value to people who are going through dental problems or dealing with fear and phobia, or they're dealing with diabetes and periodontal disease as part of the management for a more systemic problem that people are facing. And I think also we are in an environment right now that is very difficult, I'll say scary. The news is not always positive. It seems as if there's a lot going on that we don't even understand. And I have my opinions and you have yours as well. And this isn't a time when we can discuss this together because I've got the microphone and you don't, and I don't think that is particularly useful. As we go forward from here into newer things, maybe there will be times when we can talk about some of the things going on around us. But for now, I would just like to go back to some of the basics and to begin with to talk about periodontal disease and kind of how my practice works in this area. I graduated from Loma Linda University as a dental student. And then one of the blessings for me was I was put through dental school on an Air Force scholarship. I was commissioned while in dental school, but I entered active duty following graduation from dental school. And I attended an medical officer orientation program for a number of weeks in the hot sun of Shepherd Air Force Base, Wichita Falls, Texas. And then as a young captain, I went to Barksdale Air Force Base in Shreveport, actually Bossier City, Louisiana, where I took a 1-year general practice residency. The general practice residency was an opportunity to review everything I had learned in the past 4 years in 1 year, but at a faster pace, at a pace that wasn't slowed down by checking every step of every patient, because I'd already qualified and I had earned a dental degree. So now I'm a doctor, but I'm a very new doctor. And this was my opportunity to work with specialists in the different disciplines of dentistry. I said periodontics because that's one of the disciplines. And so I had the opportunity of seeing patients And when I came across things that I didn't know what to do, or they would show me new methods and techniques that I had not been exposed to, because you only have a certain amount of time in dental school to just get through it. If I had learned everything I'd learned after that, we could be in dental school for 10 years and still have plenty to learn. So the general practice residency essentially doubled my knowledge and my skills in 1 year that I had learned in the previous 4. Then I went off to Germany, and I had the opportunity of working in a small clinic, meaning that there was only one specialist who was a prosthodontist. The rest of us were general dentists, and each one of us could do whatever was along the line of our skill set. Because I had been through a general practice residency, the colonel in charge assigned me to do, with my volunteering, of course, I wanted it, to treat periodontal patients along with other patients in a general dental setting. So this is where I began to treat a lot of periodontal patients and get the skill set and the comfort of working in this particular area of dentistry. And this actually was the area where I developed the explanation of periodontal disease that I have now carried through my entire career. And I entitled it, A Tooth Has 4 Parts. And the reason I entitled it that was it allowed me to teach it to others, and they would always know where to start the explanation of periodontal disease for a patient. All they would have to do is to say, a tooth has 4 parts, which should then lead them to tell the patient what those 4 parts are. So there's enamel, the hardest substance in the body, dentin, the most volume of substance in the body. It's harder than bone but softer than enamel, so it makes up most of the tooth. And inside every tooth there is a pulp chamber or canal that holds the nerves within the tooth and the blood vessels. All of these things are nourishing the cells that created the dentin and can still be operational even as people go into adulthood. So that's 3 parts of the tooth. Enamel, the hardest substance in the body, the part everybody sees. Dentin, the part that makes up what's underneath this layer of enamel, plus the root structure. And then you have the pulp chamber and canal, the nerve. If a nerve fires off, that's your classic toothache to hot and cold. But it's the 4th part of the tooth that's important when we're talking about periodontal disease, and that has to do with cementum. And what cementum implies by its name is it's like cement, it's bone-like, but it's thin, and it's a layer of cells and mineral that surround the roots in all directions. It's underneath and microscopic, so you don't see it. And what it's holding are little fibers that project out from the tooth and attach that tooth on the other side to the bone, and also up where the gums are, it attaches to the gums. So the tooth is held into the jaws, not fused by bone, but because there is this little gap with fibers in it. This is what breaks down when we have periodontal disease. So you can have a totally normal looking tooth and have a disease that surrounds it where the gums are, and it results in the dissolution of that fiber membrane, plus the loss of bone volume, and the shrinking of gums, and the deepening of pockets. And all of this is in my videos, so that's the best place to review it. But in essence, that's where I learned to do that explanation, was in Germany in a small clinic, going one patient after another. And what that helped me do is was refine my talk over time so that it would answer questions that are important for people to understand. The most important thing I want you to get out of a tooth has 4 parts is the idea that the responsibility that you have and I have for you getting well, when people walk in, they think it's the opposite of what it actually is. Most patients who sit in dental offices, and this can be true for medical offices too, no matter how sick they are, they may believe that the physician or the dentist holds 80% of the cards that are necessary to get them well. In this particular condition that I work in, it's the opposite. I control about 20%. I can do the diagnosis, I can do the cleanup, I can do the techniques and things, the procedures that patients obviously don't do, can't do. I'll do those. But who takes care of it every day? That's the patient. Who manages it? And who also is the appointment manager, meaning they're the ones that drive their teeth and gums where they need to go, hopefully when they need to go, for the reasons that are appropriate to manage this condition. Because as it turns out, periodontal disease is a chronic illness that has an acute phase, if it does, that maybe the tooth is loose or sore or there's swelling. That's something that can get somebody's attention, so they go to the dentist. Oftentimes, periodontal disease is considered the silent one. It's the toothache, it's the tooth decay that causes patients to have those very hard, sharp, painful situations where they must get to a dentist and get the pain resolved. Periodontal disease can go on for years, and it just sort of smolders, and people get used to the idea that, oh, well, I get a little bleeding when I brush. Oh, yeah, it's a little sore when I touch it, but it's not that bad. I'm getting by okay. And what's happening is that slowly over time, they're losing attachment of the bone and the gum tissue to the tooth so that the tooth becomes loose and eventually falls out. So the responsibility is 80% with the one who has most management of a daily basis and gets the mouth to the providers at a reasonable times in order to control the condition, because nothing that I'm going to do will eradicate the repopulation of bacteria in somebody's mouth. That's part of what exists in the nature of mouths, that there are bacteria. They float around in the saliva. And most of them, I will tell you, are good, and they're healthy, and they're helpful, just like a lot of the bacteria that are in the stomach and the small intestine, large intestine are useful toward health. But we have some bad bugs, and they can take over, and they can cause destruction, and that becomes what I am looking to keep out of the situation in order to maintain the teeth indefinitely, as long as we can. So that's the objective, is to keep the pocket small, to make sure that, or try to make sure that these bad bacteria, which we call anaerobes, because they don't utilize oxygen, don't have a place where they can live and dominate and destroy the normal flora, the normal bacteria, and thus cause real severe problems. So that's the nature of periodontal disease, which brings me to talking about the podcast. All of this that I've told you, if I say this to every patient while they're in my office, I would run so far behind that people would be very frustrated waiting for appointments. So the podcast is a beautiful way of providing you an opportunity to listen to me whenever you wish to, under the circumstances that are most convenient for you. Now, you certainly can go back and listen to other podcasts, and I encourage you to do that. The best way I would say to do it is don't go chronologically. And that's just too much. 90 of these? I don't think so. I think what you do is you go on my website, you look at the different tabs to see what might be interesting. If you are having insurance questions, go to the finance tab, look for my podcasts on insurance and listen to those. If you're having gum recession, then look for my podcasts that deal with gum recession. If you're dealing with smoking, you can find podcasts on that. One of the really good ones is to listen to the one on the lead shield and x-ray, how we no longer really need the lead shield, and that podcast explains all of that in a lot of detail. Coming up shortly, I will be going to the Dominican Republic for a week to do mission work with Christian Medical and Dental Associations local here in San Antonio. I'm looking forward to this because it's an opportunity for me to spend a week with dental students as well as medical students, nursing students, and other healthcare people. And a lot of my colleagues, we've become great friends over the years. And so this is an opportunity to go and to serve together. And we always come back more blessed than anything we can provide others, even though they are very needy, and we're glad to be able to provide the help and also to encourage those who are the full-time missionaries that are in the area where we're going. So you can keep me in your prayers. I sure would appreciate it. I'll be gone the last week in May to the Dominican Republic. Have never been there. Have been to mission trips in Guatemala and Mexico. So it's not that unusual for me. We also through the year work in a refugee clinic here in town that is helping refugees from a lot of countries, war-torn countries. And also we work with the homeless population downtown and do dentistry for them, taking out teeth, dealing with infections, cleaning, all of that. It is something that I have found very deeply helpful to me and to you, because I believe that a lot of the way I treat people, and it doesn't matter who they are, I've learned it on the mission field. And I think that that's a great way to learn how to perform dental care is to know how to do it, even to the least that are around us, and provide that same care. I had a friend, actually he was an instructor, became a friend in dental school, who was a pediatric dentist. And he would talk about how to deliver a local anesthetic, which is, everybody calls it the shot. We don't. We call it local anesthetic. But he showed ways in which to do it where the child never saw the needle. You can hide it. You can do some certain ways. Now, that isn't being, it is sort of being deceptive to the eye because it's so frightening. They already have such a horrible picture of things. They've been told. So if you can do things to where they're not aware and you do it in a painless way, then it doesn't really matter that you're using a needle if they're not feeling it. So his point to me was, well, if you do that for a child, why wouldn't you do the same thing for adults? And that's true. Why? When I go in and have my blood drawn, I don't watch them draw my blood. I don't want to see the needle go in. Why should I do that? I don't have to. If I am in an instructor mode and I'm helping somebody start an IV on me, which I've done many times, yeah, I'll watch and I'll help. It's not a problem. But if I'm the patient, I'm not going to watch. I'm just going to relax. I'm going to look away. And that's part of what I would say to you is, number one, be honest. If you're feeling nervous, let me know. And I will do everything I can to make it as comfortable for you as I possibly can. And we have sedation and other methods too. So that's about it today. I am so glad that you're listening to my podcast, and please share it if you wish. And have a great day. Thanks for listening. Bye for now. The machine at the coin factory just suddenly stopped working with no explanation. It doesn't make any sense. Now go floss.